With 45 confirmed cases in the first 4 months of this year, public health officials in Quebec were worried about the possibility of a major measles outbreak. Some schools in Montreal had vaccination rates as low as 30 to 40%, and there was a possibility that thousands of children could be infected. But things have stabilized.
We've had no locally transmitted measles cases since March 25th.
He says the outbreak is now under control. So how were public health officials able to do this? The first part of their strategy was to quickly contact people they knew had been exposed.
So we were able to contact relatively rapidly all the people who were at risk, who weren't adequately vaccinated, and we were able to give them post-exposure prophylaxis.
The next part of the strategy was targeting specific neighborhoods and schools with low vaccination rates.
There was a concerted effort to go into at-risk areas and do what we know works, which is to get people vaccinated as soon as possible, at least get them their first dose.
Vaccination was well accepted. The students, the parents responded well. So, some schools went from very low to as high as 85, 90% vaccination coverage.
Despite the success, this isn't over. Experts say we should expect more mini outbreaks, and they say we need to be more proactive.
And I think if we don't take away the lessons learned from this outbreak, we're going to be doomed to repeat it. Measles is really just the canary here, right, in the coal mine, in the sense that it indicated to us that public uptake of vaccines lagged.
He says that's not necessarily because people are against vaccines, but he says public health officials have to continue to constantly remind people of the benefits and to make sure that vaccines are widely available and easy to access.